Hey Jen, how are you?
I'm good, how are you?
Good, and hey audience.
Hi.
I'm Meg and I'm here to show you a couple of massage moves. Today we're going to do some side lying work. Are you up for it?
Absolutely.
Okay, fabulous. So side lying, sometimes you'll hear people call it sideline, which isn't actually correct, but I don't know, it's a fun football term, so why not, right? But actually it's called side lying, and I guess, can you guess why it would be called side lying?
Because you're lying on your side?
Exactly. All right, so we're going to show you now how you would get onto the table if we're going to start side lying. So what I'm going to do is I've got a couple, I'm going to come around to the other side. I've got a couple of pillows set up for you here, okay? So we've got a pillow that your head is just going to lie on, and then we've got this really nice comfortable body pillow. While you're on your side, you're just going to cradle your top arm around this pillow, and then your lower leg is just going to cradle around that pillow as well, with your bottom leg straight out underneath you. Once you're on the table, we may shimmy you back a little bit to get to the edge of the table, and then you're just going to do a nice gentle roll, and the roll is really for me. When you roll, that opens up your back so that I have access to it, okay? Does that make sense?
Sure.
All right, fabulous. So let's go ahead and start with that. So now, normally, Jen, sometimes when people are getting a massage, sometimes they're clothed and sometimes they're not. For the purposes of today's demonstration, she's going to stay clothed. She's got her athletic gear on, so we're good to go. Obviously, if she wasn't, she'd be properly draped and I would leave the room and then come back in. But since we're all staying clothed today and going to work on some stretching, let's go ahead. So she's going to go ahead and lay down. Great. Perfect. And you notice she's just wrapping her arm around here. Does that feel comfortable for you?
Yeah, that's fine.
Okay, so now that she's comfortable, I'm going to make myself a little bit more comfortable by raising up the table. Okay. And we're just going to start by some gentle compressions just to open up that hip area, give a little bit of love to that lower back area, warm everything up. Now, normally we would work on the full back as well, so we would kind of be working down the back here, working from side to side. But today we want to do some work into the hip, glutes, IT band, and give a little bit of stretch to that hip. So you're open for that today? Great, okay. So the first thing we do is we're always going to get permission when we're working on an area. Jen and I have talked earlier, but you're comfortable with me working on your glutes?
Yes.
Great. Now, it's with massage, I'm in your personal space, but if it's a little too much for you, either pressure-wise or if you would just like me to move slightly, let me know and we'll readjust accordingly, okay? All right, so we're doing some nice compressions into this hip area. And after this hip area is warmed up a little bit, I'm then going to go ahead and just grab your leg here, and I'm going to wrap it right into my hip, okay? And we're just going to give a little bit of pressure to her glute and a nice little stretch here, all within her normal tolerance for stretch. Now you'll notice as we go through each stretch, she's able to go a little bit further. We might have talked about this in another video, but this is a little bit of a hat trick. Usually what happens with your central nervous system, your nervous system in general, is first time you can't go as far, and then the second time and the third time you can go a little bit further. So it would be great if I could take credit for this and say, oh, I've increased your range of motion by X percentage. The problem is, if we were to retest you in 20 minutes, you'd go back to your reset point. And that's why movement throughout the week, what I do should be what gets you started into movement throughout the rest of your days, okay? Great. So how's that hip feeling for you?
Feeling stretchy.
Good. So it's feeling nice and stretchy, she told us just now. All right, we're going to go ahead and just give a little nice little tug, really gentle and really supportive. Okay? Now I'm going to have Jen do a little bit of work with me. So Jen, I'm gonna have you raise your leg up for me. Just wanna raise it so it's like a nice parallel line. And what I'm gonna have you do is just go ahead and bend at the knee here and staying on that line as much as possible. The pillow's a little bit in the way, but that's okay. Bring it up towards your shoulder. So let's see how much you can normally go as you kind of bend up. Oh, and Jen's super bendy already. So that's all that yoga, right? Yeah. So we're not going to make a big increase here, but we're going to go through this anyway for the purposes of filming today. And what we're going to do is, you could see she could come all the way up to here. Well, we're going to isolate some of the muscles in her glutes, in her hips, and then at the top of her hamstrings here, which is going to shorten everything up a little bit. For some people, if they're having pain in their piriformis or in that area, this is a great way to pin and stretch that area. So I'm just going to place my elbow in here. And this is not, I just want everybody to know that I'm not using my elbow. I'm using actually the top of my forearm. This is way too sharp of an object. Okay, go ahead and come up again for me. Go ahead and bend and bring your leg as far as you can. And you see you can go a little bit less this time. And that's because we've made the muscle a lot shorter. Go ahead and come straight out. Go ahead and rest down. And then we would do that a few times normally. And when we came up again, and go ahead and bend again, we would test again to see how that area is feeling. Is there still that pain? If there was any, Jen doesn't have any pain, so we're just pretending a little bit at this point. Okay, and then we're gonna warm that up again. She can come back to her side lying position right onto there. That felt all comfortable and safe for you? Okay, so that's gonna be our side lying demonstration for today. Thank you so much for helping me out.